Today my topic is anaphylaxis. Today will be covered contents, definition of anaphylaxis, pathophysiology, allergen sensitization, sign and symptom of anaphylaxis, trigger of anaphylaxis, causes, factor leading to fatal anaphylaxis, differential diagnosis of anaphylaxis, acute management of anaphylaxis, observation after anaphylaxis. Definition of anaphylaxis. Ana means without, anaphylaxis. Phylaxis means protection. Acute multisystemic allergic reaction involving skin, airway, vascular system, GI system. It is a type 1 hypersensitivity reaction. Pathophysiology. It is due to release of inflammatory mediators and cytokine from mast cells, release of mediators from basophils, antigen invades body, plasma cell produce IgE antibodies against allergen. IgE antibodies attach to mast cells in body tissue. Mast cells and basophils release cytokine. Allergen sensitization. Allergen sensitization is a process in which a normally harmless protein leads to the production of a specific type of allergy antibodies. Sign and symptom of anaphylaxis. Mild or moderate reaction, swelling of lips, face, eyes, tingling mouth, abdominal pain, vomiting. Severe anaphylaxis. Watch for any one of the following sign of anaphylaxis. Difficult noisy breathing, swelling of tongue, swelling tightness in throat, difficult talking and hoarse voice, wheeze or persistent cough, persistent dizziness or collapse, pale and floppy. This diagram shows the sign and symptom of anaphylaxis. This diagram shows the anaphylactic reaction. Trigger of anaphylaxis. Less common causes include exercise with or without food, cold temperature, immunization, and unidentified idiopathy. Causes: drug allergy, blood transfusion anaphylactic reaction, anaphylaxis drug stem cells infusion, food anaphylaxis, sitting and bites anaphylaxis. Drug allergy. Adverse reaction to drugs are a significant problems. However, allergic reaction are rare. Drug allergy is not more common in those with others allergies and early runs in families. Hello? Hello, sir?
Yes, Sarah. Yes,
Yes, sir.
Continue, Sarah. It's okay.
we can hear you.
Anacids. Majority of reaction are not IgE mediators. Occurs in approximately 1% of general population, 10% in those with asthma. IgE mediated reaction to NADs are characterized by urticaria, angioedema, or anaphylaxis. Antibiotics, uncommon, occurs in approximately 1 by 10,000 courses of penicillin. Testing is only unavailable for a limited range of antibiotics. General anesthetics, rare, occurs in approximately 1 by 5,000 or 1 by 10,000. Specialized testing required. Vaccination. Anaphylaxis to vaccination is rare, occurring in approximately 1 by 250,000 doses. IgE mediated reaction are often due to vaccination components rather than the vaccine material itself. Symptoms usually appeared within 5 to 30 minutes, but delayed reaction can occur. ATG infusions reaction. ATG administration can be complicated by several infusion reactions, including fever, chills, arrhythmia, dyspnea, oxygen desaturation, nausea, vomiting, diarrhea, abdominal pain, hyperkalemia, tachycardia, hypo or hypertension, malaise, rash, urticaria, headache, severe headache, hepatic encephalitis, and even systemic anaphylaxis. Anaphylaxis and acute allergic reaction are based on IgE effects and histamines released by mastocytes. Others, rear local anesthetics and herbal remedies, X-ray contrast agents, or patent blue dye used in sensitized nodes biopsy in breast cancer surgery. Blood transfusion anaphylactic reaction. Life-threatening emergency occurs within a few seconds to minutes following transfusion of few ml blood, characterized by rapid onset of bronchospasm, respiratory distress, and hypotension. Systemic symptoms, dyspnea, hypotension, cyanosis, consciousness, chest tightness, initially mild up can progress to loss of consciousness and in rare case death. Can occur with all blood products, but generally unseen with serum albumin, plasma protein, fractions, or coagulation factors. Anaphylactic and anaphylactoid reaction. Anaphylaxis can range from mild urticaria to severe shock and death. Incidence in 1 in 20, 50,000 to 20 to 50,000. Sign and symptoms. Anaphylactic. Coughing, dyspnea, nausea, emesis, bronchospasm, flushing of skin, chest pain, hypotension, abdominal cramps, diarrhea, shock, and death. Anaphylactic. Urticaria, per orbital swelling, dyspnea, or perilaryngeal edema. Treatment. Stop transfusion, keep IV line open, epi 0.3 ml of 1 ratio 1000 in IM. Consider IV epinephrine drip, steroid ABC plus minus pressure sports, anaphylaxis drugs during stem cell infusions. Patient can have mild to severe reaction to a stem cells infusion. Autologous stem cells tend to be cryopreserved. Patient can experience allergic reaction, including nausea, flushing, rash, chest tightness, shortness of breathing, and chills. Food anaphylaxis. While 90% of food allergic reactions are caused by egg, cow milk, tree nuts, fish, shellfish, seafood, and soya, any foods may cause an allergic reaction. It is important to note that not all patients with food allergy are at risk of anaphylaxis. Food allergy affects 10% of infants less than 1 year, 4 to 8% of children less than 5 years, and up to 2% of the adults population. It is important to note that food allergy can develop at any age, not just in childhood. The most common food allergies are egg, peanuts, and cow milks in children. Anaphylaxis, stings and bites. The major cause of sting anaphylaxis are honeybees, jack jumper ants, and related ants species. Allergies to sting and bites are rarely inherited and do not commonly coexist with other allergies. Most reactions to bites and sting are local swelling that are not life-threatening. Factors leading to fatal anaphylaxis. Whilst mild, moderate, and even severe allergic reactions are common, death from anaphylaxis are rare. However, several factors increase the risk of fatal anaphylaxis. Delayed or no administration of adrenaline, upright posture during anaphylaxis, asthma, food allergy, age, initial misdiagnosis, systemic mastocytosis, differential diagnosis of anaphylaxis, tissue swelling, condition mistaken for upper airway edema, flushing syndrome, neurological syndrome, other causes of collapse, acute respiratory distress, pain disorders, acute management of anaphylaxis. Essential steps in acute management of anaphylaxis. Placing the patient in the supine position to improve blood return to the heart. As fatality can occur within seconds if a patient stand or sit upright suddenly. If the patient is having difficulty breathing, allow them to sit but do not allow them to stand or walk. Patient who are vomiting or pregnant should be placed in the left lateral position. Intramuscular injection of adrenaline into the lateral mid-thigh, 1:1000 R1 mg per ml at dose of 0.01 mg per kg with a maximum dose of 0.5 mg per 0.5 ml. Adrenaline is the first line treatment of anaphylaxis and acts to reduce airway mucosal edema, induce bronchodilations, induce bronchoconstriction, and increase strength of cardiac contraction. Intravenous fluid restrictions with intravenous fluid resuscitation with saline 20 ml per kg, airway support and ventilation, supplementary oxygen, remove allergen if still present. Call for assistance, do not leave the patient alone. Provide supportive management when skill and equipment are available. Monitor pulse, blood pressure, respiratory rate, pulse oximeter, give high flow oxygen and airway support if needed, obtain intravenous access in adult and in hypotensive children. If hypotensive, give intravenous normal saline 20 ml per kg rapidly and consider additional whiteboard intravenous access. ATG infusion reaction management. ATG infusion reaction can be reduced in frequency and severity by two factors: pre-medication, speed of infusion. Observation after anaphylaxis. Patient should be observed for at least 4 hours after last the dose of adrenaline. Patient will require overnight observation in hospital if they had a severe or protected anaphylaxis. Example, require replace dose of adrenaline or IV fluid, have a history of asthma or severe protected anaphylaxis, have other concomitant illness. Reference. Thank you so much. Any questions?
Thank you, Saira.
Thank you, sir.
Any questions? Yes. Okay, if not, then we can, Steve, are you ready?
Thank you, sir.
Thank you, Saira.
Thank you, sir.
Yes, sir.